The last joint we need to address in the upper limb is the inferior radioulnar joint. And this is a modified ovoid with the radius being the concave surface. But it is part of a complex now, and in the superior joint the radius is convex. So between the two, when they're functioning together as they must do, it actually becomes a modified Seller joint. It's only got 1 degree of freedom, pronation and supination. So we only have one glide to concern ourselves with. And we'll do this in lying. Can you lay back for me, Nora? Okay, just move over a wee bit that way. Good. Okay, now from this position, if I'm testing supination, the radius being concave will glide in the same direction. So with the hand in a fairly neutral position, or the forearm in a fairly neutral position, stabilise the ulna and just take the radius and glide it medially and laterally on the ulna. And you're testing supination as you push it back, pronation as you pull it forwards. So there's the test. Really quite simple, as is the treatment. In order to treat this now, we will bring the arm into its fully supine position, if that's the movement that's limited, stabilise the ulna again, put the thenar eminence on the radius, and then with a straight arm and a well stabilised ulna, I just allow my body weight to drop through my arm. Like so. Okay? Now, this straight arm business is really quite important. You need to drop through this way. Otherwise, you're tending to push with your hand. It's uncomfortable, and it's uncomfortable for you and the patient, and it's not as effective. For pronation, we simply roll it over, same stabilisation position on the ulna, but this time the thenar eminence comes onto the back of the radius, and we do essentially the same thing again, straight arm it and just drop our weight through the arm like so. And this is often the technique that you're going to find that you need to do when the patient's just come out of a cast, particularly after a Colles fracture. Okay, so we've basically finished off the upper limb. Again, don't forget that this is all within the context of a complete examination, including selective tissue tension testing and so forth. And it's only once you're convinced that the patient does not have any conditions that can be managed from the selective tissue tension test, such as fractures, acute joint arthritis and so forth, that you can then come in and biomechanically test the joints of the upper limb. Thank you.